For the latest information regarding the COVID-19 pandemic in Cupertino, please visit cupertino.org/coronavirus.
Good afternoon, everyone. Thank you again for joining us. I am looking forward to updating you as to where we are with COVID, and certainly today's announcement. If we could advance the next slide. So I don't, not accused of bearing the lead. A couple of hours ago, the state, along with our partners to the north, Oregon and Washington, all three governors announced a new approach to masking for California and all three of the states. And I just wanted to highlight what those are. So effective at the end of day today, so really starting tomorrow, public indoor masking for unvaccinated and vaccinated is no longer required. It's strongly recommended. We went over this a couple weeks ago. We talked about how Californians instituting really 4 levels of mask guidance. Optional level 1, required level 4, 2 in the middle, recommended and strongly recommended. So California is moving from level 4 to level 3 for all vaccinated and unvaccinated individuals in public indoor settings. Similarly, at the end of the day on March 11th, so moving into the March 12th, schools and childcare centers can also move from the required masking to strongly recommended. And we'll go in at the latter part of this presentation really into some of the details and how that decision was made. But that is the important update. It's also important to note that healthcare settings, long-term care settings, and jails and prisons will continue to have required masking as part of the fact that they're congregate high-risk settings that we've been tracking all along. I'll also note before moving to the next slide that this is the state level guidance and that local jurisdictions, local health jurisdictions, in the case schools and school districts, may decide to keep or add additional requirements beyond what the state is outlining today. Next slide, please. So we've been talking just 10 days ago, 11 days ago, the governor unveiled our Smarter plan. We will go over that in just a moment, but really as we enter this next phase, we know that the next phase, the future, may bring future surges, new variants, and California will continue to be ready and build on what we've learned so that we can keep Californians safe and informed. Next slide. So again, alluded to this, California's Smarter plan, really these 7 pillars made up in the acronym SMARTER, all anchored in our focus on equity and addressing disparities. That's a leading foundation of what is at the heart of each of these areas, focused on shots and vaccines, masks, we'll talk more today, awareness, readiness, testing, education, that's our schools and childcare centers, and then RX is treatments. And our focus on these 7 moving forward, part of that is what we're seeing and talking about today. This notion that we can provide Californians simple, clear guidance on how to continue to keep safe throughout the pandemic, anticipating that maybe as soon as later this week, we will get the first version up of our COVID Smarter ABCs, those areas around masking and vaccines and testing and treatments and things like isolation and quarantine that we believe Californians need to know the latest and greatest in a simple, clear, one-page form. So working to put that out to all Californians very soon. Next slide. So 2 weeks ago, we came together. We told you that we would be coming back today and through those 2 weeks, looking at the data, making sure and confirming that the data trends were what we had hoped, that the change back on the 14th or the 15th, of February, where we moved from a requirement to a strong recommendation for public indoor masking for vaccinated individuals, that we didn't want to see change in the wrong direction. So next slide. Want to walk through what we're seeing today versus what we saw 2 weeks ago. Cases down significantly, down 66% case rate. This case rate was at one point as high as 300 per 100,000 per day. On the 14th, we were at 57. Today, we're below 20, 19.5. And in around the 11th of March, we anticipate that we're going to be somewhere between 5 and 15. Hopefully closer to 5. So this continued downward trend. Hospitalizations were almost just about half of where we were 2 weeks ago. That number continues to drop because of the school context that we're talking about then and today. Pediatric hospitalizations, we committed to looking at those, and they've dropped nearly the same percentage, 47%. Hospital admissions overall, this is one of the key indicators as I talk in a moment about the CDC's new framework that they provided us late last week. Hospital admissions on a daily basis are a key feature. I've told you before that during Omicron, the hospital numbers, those daily admissions have been key. So not a new framework for California. And here we've seen a decline of roughly or exactly 50% just in the last 2 weeks. Test positivity dropping even more, below 3%. I'll also say that we know that California, I'll say it again and again, even again in this presentation, that Californians and Californians regions don't experience the pandemic exactly the same way. And although these are statewide numbers, they have a range across the state. Some places still seeing their hospitals impacted, getting better, but still impacted. Other places now a couple of weeks out since they had real significant impact. Next slide. As part of Smarter, we have continued to lean in and really track information about disparities. We know just as regions across the state experience COVID differently, so do different groups and populations. This slide is just the constant reminder. I think about it on a daily basis. I know many Californians do too, that certain groups across our state, usually based on racial, ethnic, socioeconomic lines, experience COVID differently. And for Pacific Islanders, we know throughout this pandemic, they've experienced a 77% higher than the statewide average case rates. Black community, 17% higher than the statewide average for death, and Latinos, 16% higher than that statewide average. These numbers have shifted over time, wherein we saw improvements earlier for Black communities. More recently, we've seen the impact on deaths even greater. Latino communities have early on experienced some of the worst of our disparities. Today, through some important efforts, some of those disparities and gaps have closed. And then the second box here, we know that 24% higher than the statewide average for cases for lower income communities and lower income households. So again, a reminder that COVID has behaved as we expected, has really unmasked current existing underlying inequities and driven through additional disparities that we want to keep our eye on today and moving forward. Next slide. This slide, something you've seen before, that vaccines have saved lives and reduced transmissions. If you look at some of the key indicators we've talked about from the beginning, case numbers, hospitalizations, and deaths, the red line is the unvaccinated line. And the two lower lines, the blue and the green, are vaccinated but not boosted, and vaccinated and boosted. And you see that vaccines continue to be one of the most impactful interventions, mitigating tools that we have had. I like to call them a miracle that they've been able to be developed so quickly that they came to the aid of so many Californians, so many Americans, and so many citizens of our globe to really save lives and impact especially the worst outcome of death. And you can see the striking difference between the unvaccinated and the vaccinated that continues, despite conversations about, well, they don't do as much during Omicron than they did during Delta or at other moments. We continue to see this stark difference among the vaccinated and the unvaccinated, that California is not just a state that talks about getting to immunity, getting everyone vaccinated, but part of that is keeping up our immunity and recognizing that it may require additional doses in boosting, especially for the most vulnerable, to keep them safe. And in a day when we focus on masking, I want to take a moment to remind folks of the strength and the benefits of vaccines, that they do save lives, that they do reduce transmission, and that they've been a key part of the success that has helped California have a winning formula compared to other large states in the nation. Next slide. All of that said, it's important to share where we are on vaccines by age groups. We're talking today about students, younger Californians. You can see that they have lower vaccination rates. The 5 to 11 have some of the lowest vaccination rates among any group. They have the lowest. And part of that is because there's still a lot of questions, a lot of good questions by parents and communities about the effectiveness of vaccines, the safety of vaccines, and they haven't been approved as long. So we know that the slope of that line is encouraging, that it's continuing to go up, that the protection around severe consequences from COVID is still very strong, even for our youngest citizens. And then I look at the top line, our oldest Californians, 65 and older. You heard both the governor and I talk about the need to focus on boosters. Boosters not, yes, boosters for all, but also boosters for our most vulnerable. And that is a population that, although we've seen a tremendous uptake of booster shots in California, we know that brown and black Californians in hard-hit communities by COVID are lagging behind. And so a key disparity for our state, as we talk about getting more shots to younger Californians, our focus is also on making sure we maintain boosters availability, continuing to deliver consistent, clear messages to the importance for our older, most vulnerable Californians. Next slide, please. We shared this slide 2 weeks ago. I think it's one of the more impactful slides that I can share with you today as we talk about really moving from required masking to strong recommendation, a time when I know a lot of jurisdictions are going to look to the state and our evidence to support a decision to continue masking in some parts of our communities. And there is clear evidence that masks do help and reduce transmission. For any healthcare professional who's taking care of somebody with a known diagnosis of an airborne respiratory pathogen, when we don a respirator, a well-fitted N95, we feel confident that we're protected. We walk in and care for that patient with confidence, and this slide demonstrates that. This 83% reduction in odds of being infected with a high-quality N95 or KN95. Surgical masks, cloth masks do also provide important protection over no masking. So in a day when people are saying, well, what should I do? How do I make a decision moving forward? This is an important piece of evidence that was created here in California. The CDC published it, yes, but the data is here, real life experience from Californians at the end of last year. Next slide, please. We knew that today's focus is in part what's happening in schools. So we looked and told you we would at what's happening with the pediatric data. And California's among the lowest pediatric hospitalizations compared to other states. And this is in part about the important mitigation tools that we've equipped schools with throughout this school year. We built and put a lot of energy into building up testing capacity last year. Many schools, thousands of schools and districts have weekly testing programs that are able to help pick up cases early, understand whether a school is facing an outbreak, and understand whether that transmission is happening within the school or in the community. Thankfully, we've been able to support that so much of transmission is happening in communities, not schools, because of these mitigation approaches. On top of that, the really thoughtful hard work around isolation and quarantine, the evolution of our guidance, now really focused on group notifications of exposures, encouraging those who have been exposed to get tested and to stay home when you're sick. Those tools, I think, have helped us make sure that our pediatric hospitalizations are low, on top of the importance and the effectiveness of masking. This should be a point of pride for California, that in place in an era when we can protect young people to a significant degree, to see that we have done that effectively, not just in our schools, but in our communities, I think is very important. Next slide. So I mentioned briefly the new CDC framework, a framework that focuses largely on severe disease, largely on the health and the robustness of your healthcare delivery system. Simply put, 3 categories: low level of metrics, medium level of metrics, high level of metrics. And you can see California's a state with a little bit of each, maybe more of our regions that are in the high category, fewer in the low. But we know that the data is trending in the right direction. And this week, when this is updated, I think it's updated weekly, we should see more green, certainly more yellow, and less orange than we see today. And that is in part the framework, the benefit of this framework. We think that the framework does help us focus on some parts like the severe disease consequences and making sure we're protecting against that important objective. But it's still just the framework that we add among other frameworks that California has used. You've heard from me before, the focus on hospitalizations. So that's not a new addition to the toolkit that we have used to help guide California's approach. And it won't be the only element that we use moving forward. Next slide. And that brings me to this conversation. We said in the California Smarter Plan that we are committed to really immediately engaging around these 2 important things: off-ramps, as we're talking today, the off-ramp from a requirement around masking to a strong recommendation, that is really focused on the hospital impact, which on the initial data slides we showed is really moving in the right direction, and rapidly so. But on an on-ramp where we might consider other mitigations, future surges, and how we handle them, we will continue to try to, as we said in the Smarter Plan, within 30 to 45 days, really understand what variant are we dealing with. Is it one that we know already? Is it one that is new? Where is the level of concern and uncertainty? What are other states, other nations experiencing when that surge comes? And what are we seeing with our data trends with test positivity and community transmission? And it's with that data in mind that we will continue to see what tools are in our toolkit, what are the appropriate tools to apply to that situation. And it may not only be framework that the CDC let us benefit from last week. So it will be a fluid, California-specific approach moving forward. The CDC and other partners are always helpful in helping guide a framework for us, but we will continue to take California's conditions into account and do what is best for Californians to keep us safe and secure moving forward. Next slide. So let's spend just the last half of this conversation focused on masking. Next slide, please. So we said on the 28th that we'd be back to reassess, and I've given you the sense of where we're moving. And so much of this has been focused on these 4 important bullets. Safe in-person instruction is essential. This is particularly for vulnerable populations who depend on schools, not just for school instruction, but for critical services, critical activities. Some depend on it for food, and some individuals depend on it for meals and other basic support. So the fact that schools need to be priority for safety and making sure people can come in person is something that California will continue to lean into. We must ensure that there is low risk of catching COVID in schools for both students and staff. That is part of that safety feature of the first bullet. We must remain prepared to adjust as the conditions of the virus adjust. I just mentioned this notion of off-ramps that we're talking about today, but on-ramps potentially in the future. And how do we assess those risks and concerns moving forward? And we will continue as a state, as local health jurisdictions, to provide COVID-19 mitigation resources to schools. This will include testing. This will include supporting procurement around masks to make sure that individuals who continue to decide to use a mask in places where they potentially move from a requirement to where it's strongly recommended, or in schools that make a decision today, those districts, those jurisdictions, to continue holding on to the masking requirement for a period of time moving forward based on their local considerations, their local conditions. The state will be supportive of those decisions and support the resources that are required to keep environments safe. Next slide. So just to remind you where we are today, that requirement for schools and childcare centers is going to be moved to strongly recommended. Next slide. Again, just the first slide I led with, reminding you here exactly what we're doing, what parents, what families should consider as we move forward. Next slide. So why are we strongly recommending masking in California and not moving to just a recommendation or even allowing them to be optional? And I think this is because we are coming out of what was one of the most devastating surges that we experienced as a state, where healthcare systems are still reeling, where they aren't quite 100% back to their baseline, that it's going to take a long road, that there's a lot of members of our community who still are at risk, that there are children who are not eligible for a vaccine yet, those kids under the age of 5. We have individuals who are disabled, those who are older, who have, yes, been boosted and been vaccinated, but still carry a significant degree of risk, even as we see numbers come lower in terms of what's circulating in our communities, that we know that individuals with compromised immune systems continue to be at risk, and those with multiple chronic conditions, things like asthma, diabetes, lung disease, and heart disease, many of which, sure, you see more of those conditions in older Californians, but young Californians are still, it's still not uncommon to see a young person in one of our schools with more than one of these conditions, and they face the high-risk environment that I have been mentioning. So we continue to lean into this strong recommendation that in our 4 levels of masking, we're really just moving from level 4 to level 3, not all the way down to level 1. That's an important consideration for local health jurisdictions, local communities that are today, as they have been for weeks, considering what they will decide to do given the appropriate decision we're making at the state level today. Next slide. So I want to wrap up by saying that we've said this before. We've talked about this at other moments with whether it's vaccines or treatments, and now with masks, that no person can be prevented from wearing a mask as a condition of participation in an activity or an entry into a business or into a school. We know that there has been a lot of community discourse about masking, a lot of individuals on one side of the issue or the other. And this is just a reminder that California respects the diversity of our state, respects the individual choice to continue to protect their health, to keep using a mask. And this is going to be an important objective, not just in our school communities, but yes, specifically in our school communities, but in businesses and across our culture and commerce in this state. Next slide. And just sort of building on that, this notion that there is a California way, and California is a place that is a place where our communities are the rival of many across the nation. That we are that way because of some basic considerations of being kind, being accepting, being respectful, and being safe. And as somebody who's been steeped deep in the decision making about how we support our state to get through this, I also often reflect, as I have multiple times with you, on what is it that I think my colleagues as pediatricians are thinking today. That there'll be patients of theirs, families that they take care of on both sides of the question. Those who've been eager to see a day where potentially they'll be in a district that makes a decision to go from a requirement to a strong recommendation for masking, and others who feel that this is happening too soon. And as a pediatrician who had the privilege for 15 years before this role of taking care of young people and families in some of the hardest hit communities by COVID in our state, where there's still questions about how effective the vaccines are, how safe they are, that there's plenty of individuals who believe that masking is a way to stay safe, to keep their kids safe, to keep their families safe, the loved ones in their extended family. And today's announcement should be one where we are saying loud and clear that those individuals are empowered to continue to make a choice to keep themselves safe, to wear a mask if that's the right decision for them, for their family, and that California will be a place where that is not just respected and accepted, but the way of our communities. And as a father, I know that I will certainly, as I have been, speak to my own kids about the need to be these four things always, and that it's something that I hope members of our community across the whole state will consider doing the same. Today is an important day for California, one that is driven by the data and the science. We're seeing extremely encouraging news, but one that I know will be received with some trepidation, and acknowledging that and giving communities time and space to make decisions based on the thoughtful listening that I know will occur is very important. So with that, I'm happy to wrap this up and take any questions.
The first question comes from Ron Lynn with the Los Angeles Times.
Hi, Dr. Daly. Thanks so much for taking our questions. Really appreciate it. Our question today on the timing of the loosening of K-12 rules, how you'd react if things go wrong, and how your masking recommendations differ from the CDC. So first, in today's call, you've credited California's pandemic rules for leading to low pediatric hospitalization rates in the state compared to others, rules that have included universal masking. Can you articulate why you think now is the right time to make masks optional as of mid-March in schools, as opposed to sticking through with it for the rest of the academic year? Second, there was a recent UC Berkeley poll co-sponsored by the LA Times that suggested widespread support for mask and vaccine policy statewide. Given that vaccination rates remain so much lower among children ages 5 to 11, how would you react if the lifting of the mask mandate in K-12 indoor settings leads to a surge in transmission later this academic year? Or do you think that's more unlikely given the trends of the pandemic? And then finally, your strong recommendation for universal wearing of masking is at odds with the CDC's guidelines. Can you explain why you decided to take stronger rhetoric and strongly recommending mask use statewide more so than the CDC? And at the risk of asking a very obvious question, what's the difference between strongly recommending mask use versus simply recommending mask use? Thanks.
Yeah, no, I'll try to answer them all, Ron. Thanks for thoughtful questions. So why now? I'll try to take them in order. Why now? Because we said we would look at the data. We're seeing really encouraging trends. We know that some communities are experiencing lower than average, and others are going to be experiencing higher than average. So as we see where we're heading, as we use both the new framework the CDC provided as well as our existing framework, this feels like the right time. It said there's the data that supports it, both on the transmission end and the hospital impact side. So I think I've been pleased with how the data has come down, and it is the right moment to transition from that requirement to that strong recommendation. For individuals who say our vaccination rate is too low among our younger Californians, I would say that I agree it is too low. I think we have our work cut out for us. We need to keep working to make sure communities receive the up-to-date information about the impact of vaccines, that they're safe and effective, and deal with any of the questions that get lumped into hesitancy. Taking a knee as a pediatrician and talking to families and young people about what that might require is something I hope happens more and more across our state, so we can get those rates up. And because of the lower transmission, the rates that we're seeing come down pretty nicely, not just over the last 2 weeks, but we project coming down even more over the next couple of weeks to rates that some states on the East Coast are already experiencing, states like New York and Connecticut that have lower than transmission rates than we do today. We anticipate being right around those levels in about 10 days, and that is reassuring to us. The strong recommendation is really about context, about what our state has been. The CDC provides guidelines and a framework that is meant to work for the entirety of the nation. For states that have had very different sorts of approaches to the pandemic, we in California have leaned in to our health protective measures, to the fact that we were set out to save lives, and we've done that in large part. So it shouldn't be a surprise that we try to provide some nuance, that we try to tell our communities that given what we just came out of with Omicron and the surge, given the reeling communities that still exist today, that we will continue to strongly recommend at this moment. And then one day we will go to a recommendation, and maybe even that they're optional. And then what's the difference between strongly recommended and recommended? It's really about what people might pick up as the health professionals, the health community is really leaning into who might consider wearing a mask for longer, those who are high risk, those who may yet not be fully vaccinated or eligible for vaccines, that the strong recommendation is something to reinforce that we're not just moving from required to optional, but that there's gradations here. And we expect, as California's conditions continue to improve, and we hope they will, and expect they will, that we could move our strong recommendation down to a recommendation in the near future. I think I caught all of them, Ron, but if I didn't, let me know.
The next question comes from Ashley Zavala with Nexstar Media Group.
Hi, Dr. Galley. I don't know if you're maybe the right person to ask this, but today's announcement included Washington and Oregon. And I'm wondering, it's bringing me back to the Western States Pact that was established back in April of 2020. This is really the first update where we're hearing those states included in a really long time. I know Colorado and Nevada went to sort of different directions with their COVID approaches. I'm just wondering, where does the Western States Pact stand now?
Well, I think we've continued to work with those partners more than any other throughout this pandemic. That's where it started. That's where it continues. I think a lot of alignment conversations between different levels of leadership at California. I know that I enjoy relationships with some of their key health advisors there, and the conversations about how we're heading together, I think, were really, really important in this case. This is a critical decision. This is an important point of message about how, frankly, the West Coast has largely approached the pandemic different than other parts and regions of our nation. So I'm not surprised that this one came into alignment, and it's something that I'm sure others may have different takes on, but it really builds on what has for many, many, many months been a long and robust set of conversations between our three states.
Next question comes from Alex Michelson, Fox 11.
Thank you, Dr. Galley, for taking our questions. I'm curious why the 2 weeks. Specifically, we know that older adults have worse health outcomes when it comes to COVID than kids do. And yet right now, older adults can go unmasked in so many different aspects of daily life, but kids can't. And I'm wondering why the disparity and what role the teachers' unions have in negotiating this, if any.
Well, first off, I don't have the interactions or the conversations with some of the labor entities that you're talking about. I am making recommendations with my team based on the data and information. And the 2 weeks is important because we see ourselves getting even lower, creating even less likelihood for community and, frankly, school transmission. And that is key. If we can cut transmission rates by 25 or even 50% more in the next 11 or so days, that creates an even lower risk of individuals, masked or unmasked, from getting infected in schools, which are really essential places, unlike some other entities, places where we have a lot of choice as to where we might go. We may choose one grocery store over another based on a number of factors. Many families and young students don't have a choice. They go to school because that's the school in their neighborhood. That's the school they're assigned to. That's the school where they get essential services, developmental services, access to food. And so we have all along treated schools a little bit differently. We recognize the real difference in risk for young people from infection, for severe disease, and we don't dismiss that in any way. But California has said from the beginning, keeping schools safe is one of our key strategies, key points of focus. And I think this announcement and the staging and timing really drive that point home, and something that I know not even 2 short weeks from now, we'll be having the conversation about how sort of both settings are in the same place. But at the moment, we think giving that little bit more time to arrive to some of those even lower rates is important.
Next question comes from Laura Cordy of the Sacramento Bee.
Hi, Dr. Galley. Always appreciate you taking this time to talk to us and answer our questions. I know we touched on this a bit 2 weeks ago, but I wanted to ask if the state is planning to take any action against districts who lifted their mask mandates prior to this order. They're technically violating a state law, but it's not clear that they're experiencing any repercussions for that violation.
Yeah, I think, as I mentioned then, and I continue to mention now, we have the state-wide mask mandate in place for a reason. We support how it helps us get to the place where we are. I think the slide where we show the lowest pediatric hospitalizations among big states is part of the punchline, part of why we continue to say, please to those districts that we continue to heed these orders and keep them in place. I think that, as you know, the issues around enforcement, whether it's at the state or local level, have been tricky throughout the pandemic. We want to make sure that our messaging is not just one of a law, but one that really is one that empowers communities to pay attention to the health risks and health factors that might drive that decision. So we are moving forward. I know that some people are concerned about what the next 10, 11 days brings, but I'm confident that we will continue to see the schools keep masks on. I know it won't happen everywhere, but I think in the vast majority, the message will be heeded. The anticipation for preparing around a change, if that's what a district decides to do, if that's what a county decides to do, will take a little bit of time, and that we will sort of get through this period and really allow some of those local characteristics, factors drive the decision, as I made reference to before.
Next question comes from John Wofolk with the Mercury News.
Hi, Dr. Galley. So that if I understand correctly from the CDC's announcement on Friday, they would, according to their assessment of the situation in California, have significant parts, almost like half the counties, where schools could already be mask-free. And so basically the state is out of sync with the CDC on that, if I understand that correct. But then, and I think this was mentioned earlier, so tomorrow, vaccinated or unvaccinated, the mask rule outside of schools goes away, so the kids, can go to the grocery or the clothing store, vaccinated or unvaccinated, without a mask, but they got to put it on in school. How do you explain to the parents out there who've been frustrated with these rules and don't think that they're based on any kind of science or anything?
I think a couple of things, John. I would say first, the explanation is the one that I gave already, that schools are a place where we try to create a safe environment for all individuals, that the level of choice in the school you're attending, the conditions at that school are really left to making sure, by schools and school administrators and public health partners, and that happens at the local level and the state level. So the idea that certain businesses that may or may not entice or recruit individuals to come in through their doors are different than schools. So the notion that what we're asking happen in schools has been different and maintains for a short period more a difference, I think shouldn't be surprising, and I hope is something, and I'm happy to always try to explain it over and over to our public as the choice that California has made to keep kids in schools. I'll remind you that we've had, for a state with 12% of the nation's students, to have less than 1% of the closures, even far less than 1% of the closures this year, I think is attributed to the approach that we've had. So that is the explanation to those parents who are maybe feeling frustrated with the way we've approached it to date. And I will tell you that we know for each person out there who may have one view of the decision today, that there's another family, another young person who has a different view. So public health is not necessarily about balance. It's about leading with data and science and communicating clearly. And that's what we're certainly trying to do today as it relates to the CDC and what they would say about California's decision today. I think both from my individual conversations with leaders at the CDC and also their framework, they provide guidelines and recommendations and a framework for states to apply locally, that conditions, just like we say, local counties will maybe make different decisions than we've made at the state, and we support those, we back those, we think they're the right way to make these decisions because those local conditions matter. I think what's happened here in California is really in that regard, and as I mentioned earlier, we've been a state that has really sought to save lives and deliver a message of being supportive of public health, supportive of the science and the data, and that will not just carry us through on saving lives and protecting health, but really keeping culture and commerce moving forward as well. And I think in many ways we've done that and done that to the best of our abilities.
Next question comes from Spencer Custodio, the voice of OC.
Hi, Dr. Galley. Thanks for taking our questions. Mine has to do with some of the state's previous investments. I know the state sent some money to local school districts to, not only do social distancing measures, during the height of the pandemic, but also overhaul a lot of the HVAC systems and install some air purifications. And I've been hearing from some local health experts that they're just kind of unclear on where that's at. And I'm wondering if the state has conducted like an official accounting or an inventorying of these systems throughout the school district to see, if these air purifications and overhauls to just the overall airflow systems have been installed in these school districts. And if not, is there like a team working with school districts, like I want to say like a strike force team, but, like a statewide school team that'll work with these school districts to get those in place? Thank you.
Thanks, Spencer, for the question, and grateful you raised ventilation and air circulation. We talked about it. Keep a window open, keep a door open, keep things outside for some of the reasons you've mentioned. And yes, we know a number of schools have really been innovative. They've come up with different tools, different ways to increase ventilation and air circulation and air quality indoors. We have so many important leaders in Southern California, Northern California, who think about this. And part of the governor's Smarter Plan announced just 11 days ago had a focus on what we would do on ventilation and indoor air quality, creating a task force that we are busy putting together the framework on and determining how they will move forward. And trust me, a part of that task force will be focused on schools, learning from the innovations and lessons that have been brought forward through the pandemic up until now, and then encouraging more scale and spread of some of those important tools. And then a second thing was the announcement of an innovation award, challenging California's scientists, our engineers, to really come up with new strategies to improve and scale up those improvements across our state, with a focus particularly on schools, particularly on some of our important businesses as well, but certainly more of that to come. I'm not aware that we have a record of which districts and which schools did what with some of that funding as it relates to indoor air quality, but I know many did make those investments, whether it was improvements in filters or new innovations to help increase circulation. And I think we all think that those are tools not just that help with COVID, but are going to help with so many other issues around air quality, other infectious diseases that are at risk for young people in schools and adults as well. So looking forward to continuing that drumbeat here in California and leading the way.
Next question comes from Morgan Reiner with ABC.
Hi, thank you so much for taking my questions. I'm just wondering what the conversations have been like with Governor Newsom to come to this new decision, and wondering why he is not with you to make this highly anticipated major announcement.
Yeah, I mean, they've been constant. I'm sure he looks forward to the day. He doesn't need to talk to me every single day about these things, but I think they've been constant. And I guess what I would say about your second part of the question is the governor made this announcement today, put out a press release. I think it's been just over a couple hours ago. He and his other governor leaders along the western states to really walk through what the decision is. And I think that probably for many of you, you're not hearing this news from me. You heard it directly from him just a couple of hours ago.
Next question comes from Samantha Young with Kaiser Health News.
Hey, Dr. Galley, thank you for taking our questions. Wanted to ask, the New York Times today had a report that the Pfizer vaccine isn't as effective in kids in the ages 5 to 11. And I'm wondering, with lifting the mask mandates, are you concerned at all that there could be another surge in the schools if these kids who aren't as protected against infection with their COVID vaccine, might there be another surge? Is that a worry at all?
That data, obviously it's new data out of New York. I think a thoughtful look at what's happening with our youngest kids getting vaccinated, and not what any of us want to see, but that's why we process the data both ways. That supports what we're doing, and that causes us to really kind of work harder to understand where we should go next. And I think with this, the good news is we're making this decision with the knowledge that we have work to do on vaccines in 5 to 11-year-olds, that we want to get them more vaccinated as a group. The study that you're referring to mentions that the vaccine effectiveness against severe disease is still quite good, that hospitalizations and even worse outcomes for young people are still pretty protected by getting vaccinated. And I think that is an important anchor to where we are today, and that the lower transmission rates in most of the state are really what's guiding where we are today, the continued decrease in impact in hospitalizations. And if we see those trends change materially, as we would at any other time in this pandemic, as we said, we would focus on moving forward in the California Smarter Plan, that we would continue to assess that information and make a decision if that requires us to use a tool that we aren't currently using to make sure that environments like schools and other places are safe. So more to come. Just looking at the data and the trends, we really do anticipate that we'll continue to see reductions in all of the metrics that I shared with you on an earlier slide, and that through the next weeks and months, that will be the case, not because of only the things we do, but the characteristics of the virus, the fact that it will circulate less as it has been over the last few weeks already.
Next question comes from Catherine Ho with the San Francisco Chronicle.
Hi, Dr. Galley. My question is about the lifting the indoor mask requirements for unvaccinated residents and the general public. Why did you not link the timing of that to, say, a certain vaccination rate? For example, waiting until 85 or 90% of residents or whatever are vaccinated. And does the decision to not tie it to a specific vaccination rate have anything to do with the belief that everyone who wants to be vaccinated has probably been vaccinated by now, and it's probably not going to get that much higher?
No, it's not related to that in any material way or any way at all, really. I think it's we still have this strong belief that among unvaccinated Californians, there's still a significant number of those who are still in wait and see. I still get letters every day from people who share a story about a loved one who did get vaccinated. You see them, many of your colleagues report on them. So this idea that we've sort of hit our peak, I think, is untrue. We know that it's this takes more work. It takes more sharing of information to continue to keep our vaccination numbers up. So my hope is we'll still see increased vaccination rates little by little in our state, and that even though every percentage is hard to earn, that we will continue to earn them because we do work hard in this space. As it relates to why now on that decision, I think it's because this is certainly where the CDC has moved. They last May, I think made or June made the distinction between what vaccinated and unvaccinated individuals should do with regards to masking. As we've worked through new variants like Delta and Omicron, I think the distinction among those groups around being infected is important, but not as stark as it is around ensuring that the most vulnerable are vaccinated. So the decision to sort of move forward with that now, to align with what I think is something happening across the nation, and the reality that sort of tracking vaccination status among the masked and the unmasked is really operationally difficult in certain settings. And I think it's really just sort of arriving to the place where we are as a state, and as a set of communities, that isn't a distinction at the moment that is going to be easy to put in place, especially given that the level of circulating virus has dropped significantly over the last many weeks.
Next question comes from Tom Kiskin with the Ventura County Star.
Yes, sir. Can you clarify the rules for the school masking mandate in terms of, does it apply only to students or does it also apply to teachers and employees?
Yeah, it implies so the students are governed by the general or this mask update. Schools employees are governed by standards led by Cal OSHA and other workplace standards. But in general, I think many schools are going to be making a decision on students and staff together. And the state is moving forward with this decision based on all participants or all individuals who are on a school campus.
The final question comes from Howard Bloom with the Los Angeles Times.
Hi, Dr. Galley. Thank you for taking the questions. If the state is strongly recommending masking in schools, is it saying in effect that schools really should have a local mandate, but you're not going to make them do so? And secondly, should schools in LA County where transmission is high, should they still require masks?
So the strong recommendation by the state is really just acknowledging where we are and where we've been. And we know that for certain jurisdictions, the consideration that the state is saying we strongly recommend may push those districts to make a decision to keep it required for a period of time in LA County schools, LA Unified School District, other districts in Southern California, and for that fact, Northern California may make the same choice. So I think those local details, those local conditions are really going to guide. We are saying at the state level that if the conditions warrant it and the conversations guide to it, that those districts, those jurisdictions should feel empowered to keep masking in place because that is the decision that they're making to keep their community safe. And as somebody who's stood for supporting Californians' health, that's a very reasonable decision to make, not one that I'm going to, or anyone at the state level is today going to dictate. But I fully expect that in certain areas, places that have experienced not just high transmission today, but are still reeling from its impact. Remind you, 80,000 plus Californians have lost their life to COVID. Those individuals leave dozens of loved ones and family members each who are mourning the loss, who are still figuring out what this means for them. And if you're in a community where that is a dominant factor and a dominant feature, we think that it could be totally reasonable to continue requiring masks for a period of time. So again, not the decision that I'm in charge of making, but certainly supportive of those districts and those jurisdictions that make a decision to continue requiring masks for a period of time. So with that, I think last question, I just want to thank you again for the time today. And I know there'll be opportunities to continue to clarify. And I look forward to supporting our local partners, both in schools and at the county public health level, to make decisions that are appropriate for their communities. And as we continue to approach the implementation of the California Smarter Plan, we will continue to update communities with what is really the data and science-driven approaches that California will continue to have. So with that, I hope you all have a good afternoon, and thank you for your time.
For the latest information regarding the COVID-19 pandemic in Cupertino, please visit cupertino.org/coronavirus.